Hi, I'm Stephanie. I have cervical cancer. In 2021, I was diagnosed. I had 9 months previous where I had a lot of symptoms. There was a lot of confusion on my symptoms. I wasn't being diagnosed quickly. After my diagnosis, I was so lucky that the team here were able to get me treated and started really quickly. When I met Dr. Rana, I was in a lot of pain. He talked through everything with me. He explained about, the type of cancer that I had. I had so much more detail that I could take home and research myself. Any questions that I had, he was really forthcoming and helping me to understand my symptoms better. We went through chemotherapy, external radiotherapy, and then on to brachytherapy. I don't think I'd be here today if I hadn't met him and the two of us met. I felt like everyone in this hospital has been like family to me. The doctors here, the radiotherapy girls, everyone that has worked together has kept me here, that I'm still here today. It's obviously hard on the person who's going through the treatment, but I think more so your family, your friends, everybody around you just struggle just as hard. My husband has been just absolutely incredible. I think that there's so much information out there for breast cancer awareness. As a cervical cancer patient, that we could really push that a little bit more. Go to your doctors, get your checkups, really push for that smear test. And you know what, if your doctor tells you you're not due, but you know that something is wrong, please advocate for yourself a little bit more. Us as women, we know our own body. We know if something's not right.
I'm Dr. Rana. I'm a radiation oncologist with specialist interest in treating cervix cancers. I have been treating cervix cancer for a couple of decades. It's not every day that you meet patients like Stephanie, bubbly, charismatic, fun-loving person who was serious, but at the same time, very informative, educated. In fact, I learned a lot from her as well in terms of the patient experience and the research she will bring onto the table. And of course, a very supportive husband, Dave, who has been not only very supportive to her, but also the journey it takes for patients and their partners going through cancer and the complicated treatment. We discussed about the treatment options. We were very happy to see the outcome of that treatment in terms of complete disappearance of tumor. Cervix cancer is relatively a rarer cancer compared to breast and other cancers. However, it still is fourth commonest cancer in women. More importantly, it mostly occurs in young women between the age of 20 to 45. Most of these cancers can be prevented by use of vaccination. In addition, screening programs can pick up this cancer early with 100% chances of cure. If you are unlucky to develop a larger cervix cancer, there are treatments which can still achieve cure in a significant majority of patients, and that is where this interstitial brachytherapy comes in, where you can give very high dose into the large tumors without any collateral damage, is only provided at Mediclinic City Hospital, being the only provider in whole UAE. We are very proud of that, that we have been able to help a lot of young women since the first treatment given to Stephanie in terms of disappearance of her cancer, and we are very happy to see that.